Plain water is not enough after 60. That statement will surprise people. It might even sound wrong. Drink more water. That is the advice that has been repeated for decades by doctors, by nutritionists, by every health channel on the internet. And it is not bad advice. Hydration matters. Water matters. But here is what that advice leaves out, and what research on vascular physiology in adults over 60 has been making increasingly clear. After 60, the body's ability to use plain water to maintain healthy blood viscosity, support arterial wall function, and sustain adequate circulation declines in ways that plain water alone cannot address. The problem is not the water. The problem is what the aging vascular system needs from hydration that water does not contain, and what happens to blood flow, arterial flexibility, and cardiovascular risk when those needs go unmet night after night, year after year. Most people over 60 are drinking water regularly and still experiencing the downstream consequences of functionally inadequate hydration. Blood that is thicker and slower moving than it should be, arteries that are stiffer than they need to be, and a circulatory system that is working harder than necessary to move blood through a vascular network that has lost the support it requires. This video covers what research identifies as the specific compounds missing from plain water that the aging vascular system needs, the simple additions that address those deficits without medication, without expense, and without disrupting an existing routine, and the one preparation method that research shows produces the greatest acute improvement in blood flow markers. Stay until the end. The third addition on this list is the one that surprises people most, because it is something most adults over 60 consume regularly in a completely different context and have never once connected to their circulation. Before going further, if blood flow, vascular health, or circulation has been a concern, there is a complete vascular support protocol in the description. It covers the full hydration strategy for adults over 60, the supplement compounds shown in clinical research to reduce blood viscosity and support arterial elasticity, the dietary adjustments that compound the effect of improved hydration, and the daily routine sequence that produces sustained circulatory improvement over time, built specifically for adults over 60 managing cardiovascular health long term. The link is in the description below or pinned at the top of the comments. To understand why plain water becomes insufficient after 60, the starting point is blood viscosity and what happens to it as the vascular system ages. Blood viscosity is a measure of how thick and resistant to flow the blood is. Thinner blood flows more easily through vessels, exerts less mechanical stress on arterial walls, and reaches peripheral tissues, the fingers, toes, brain, kidneys, with greater efficiency. Thicker blood requires more cardiac effort to circulate, moves more slowly through already narrowed vessels, and is significantly more prone to forming clots in areas of low flow. Research published in Clinical Hemorrheology and Microcirculation documented a consistent age-related increase in blood viscosity beginning in the mid-50s and accelerating through the 7th and 8th decades of life. The mechanism is multifactorial. Red blood cell deformability, the ability of red blood cells to change shape and squeeze through narrow capillaries, declines with age. Plasma fibrinogen, a clotting protein that increases blood viscosity when elevated, rises progressively after 60. And the hydration regulation mechanisms that help maintain appropriate blood dilution, including thirst perception and kidney concentration ability, both become less precise with age. The result? Most adults over 60 are walking around with measurably thicker blood than they had at 40, and the standard recommendation to drink more plain water addresses only one of the mechanisms driving that increase. It dilutes the blood volume, which helps, but it does nothing to improve red blood cell deformability. It does not reduce plasma fibrinogen. It does not support the endothelial function, the health of the arterial inner lining, that determines how effectively vessels dilate and maintain flexible, responsive blood flow. Research published in the Journal of the American Heart Association found that endothelial dysfunction, impaired ability of arterial walls to produce nitric oxide and signal appropriate vasodilation, is a more sensitive predictor of cardiovascular events in older adults than blood pressure or cholesterol levels alone. And endothelial function is directly influenced by the specific compounds that are not present in plain water. Those compounds fall into 3 categories. Here is what research says about each, and exactly how to add them. Addition 1. Electrolytes, specifically potassium and magnesium. Plain water hydrates. Electrolyte-enhanced water hydrates and supports the electrochemical environment that arterial smooth muscle and the endothelium require to function correctly. Potassium plays a direct role in vascular tone regulation. It acts on the sodium-potassium pump in arterial smooth muscle cells, promoting relaxation of the vessel wall and reducing peripheral vascular resistance, the resistance against which the heart must pump. Research published in Hypertension found that potassium supplementation in adults with elevated blood pressure produced dose-dependent reductions in systolic and diastolic pressure, with the mechanism confirmed as direct arterial smooth muscle relaxation rather than fluid volume change. After 60, dietary potassium intake is frequently below recommended levels, even in adults eating reasonably well. The kidneys become less efficient at retaining potassium, and diuretic medications, extremely common in this age group, accelerate potassium loss further. Magnesium operates through an overlapping but distinct mechanism. It regulates calcium entry into arterial smooth muscle cells, and calcium excess in smooth muscle drives vasoconstriction, arterial tightening. Research published in the European Journal of Clinical Nutrition found that magnesium deficiency, present in an estimated 45% of adults over 60 in developed countries, is directly associated with arterial stiffness, elevated blood pressure, and impaired endothelial function. The same research found that correcting magnesium status produced measurable improvements in arterial compliance, the ability of arteries to expand and contract with each heartbeat, within 4 to 6 weeks. Adding a small amount of a balanced electrolyte supplement to water, one that contains potassium and magnesium without excessive sodium or sugar, converts plain water into a vascular support vehicle rather than simple hydration. The volume of water consumed stays the same. What it delivers to the arterial system changes substantially. The next addition operates through an entirely different pathway, one that has accumulated some of the strongest acute blood flow evidence in the nutritional literature. Addition 2. Concentrated nitrate sources, specifically lemon juice or pomegranate concentrate. The body produces nitric oxide, its primary vasodilatory molecule, through 2 pathways. The first is the endothelial pathway, where the enzyme eNOS converts L-arginine to nitric oxide inside the arterial wall. This pathway declines significantly with age and with endothelial dysfunction. Research published in Circulation found that eNOS activity in adults over 65 was measurably lower than in adults in their 40s, contributing directly to reduced vasodilation capacity and increased arterial stiffness. The second pathway is the dietary nitrate pathway. Nitrates consumed through food and certain plant-based compounds are absorbed into the circulation, concentrated in saliva, and converted by oral bacteria to nitrite, which is then reduced to nitric oxide in the stomach and bloodstream. This pathway does not depend on eNOS function. It bypasses the endothelial decline that limits the first pathway, and it can be activated deliberately through specific additions to water. Lemon juice contains compounds, primarily flavonones, including hesperidin and iriocitrin, that have been shown in research to directly increase eNOS activity and improve endothelial nitric oxide production. A randomized trial published in the European Journal of Nutrition found that regular lemon flavonone consumption significantly improved flow-mediated dilation, the gold standard measure of endothelial function and nitric oxide availability, in adults with cardiovascular risk factors. Pomegranate concentrate operates through a complementary mechanism. It is extraordinarily high in punicalagins, L-argitanins that are metabolized by gut bacteria into urolithin compounds with documented effects on mitochondrial function, inflammation, and most relevantly, nitric oxide bioavailability. Research published in the American Journal of Clinical Nutrition found that pomegranate juice consumption over 4 weeks produced significant reductions in systolic blood pressure and improvements in arterial compliance in hypertensive adults, with the researchers attributing the primary mechanism to enhanced nitric oxide signaling. The practical addition, 1 to 2 tablespoons of fresh lemon juice or 1 tablespoon of unsweetened pomegranate concentrate, added to a glass of water twice daily. The effect on blood flow markers is measurable within 60 to 90 minutes of consumption in acute studies, with cumulative benefit building over weeks of consistent use. This works even when the endothelial pathway is already compromised, which, in most adults over 60 with any cardiovascular history, it is. The third addition is the one most people would not predict. Addition 3. A small amount of apple cider vinegar. Apple cider vinegar has accumulated a great deal of wellness culture attention, much of it exaggerated. But within that noise, there is specific and legitimate research on 2 mechanisms directly relevant to blood viscosity and vascular function in older adults. The first mechanism involves acetic acid, the primary bioactive compound in apple cider vinegar. Acetic acid has been shown in research to inhibit the activity of platelet aggregation pathways, the clumping of platelets that is a primary driver of clot formation in areas of sluggish blood flow. A study published in the Journal of Nutritional Biochemistry found that acetic acid consumption produced significant reductions in platelet aggregation in animal models, with the mechanism confirmed as inhibition of thromboxane A2, a prostaglandin that promotes platelet clumping. More directly relevant to humans, a clinical trial published in Bioscience, Biotechnology and Biochemistry found that acetic acid consumption in adults over a 12-week period produced measurable reductions in blood triglyceride levels, elevated triglycerides being one of the primary contributors to increased blood viscosity and impaired red blood cell deformability. The second mechanism involves the effect of apple cider vinegar on postprandial blood glucose. Blood glucose spikes after meals increase blood viscosity acutely. Glucose molecules attach to red blood cells through a process called glycation, which reduces their deformability and makes the blood measurably thicker for 1 to 3 hours following a high glucose meal. Research published in Diabetes Care found that 2 tablespoons of apple cider vinegar consumed before or with a meal reduced post-meal glucose elevation by 19 to 34% compared to placebo. For adults over 60, particularly those with any degree of insulin resistance or prediabetes, which research estimates affects more than 50% of this age group, the post-meal blood viscosity increase is a recurring daily event that compounds arterial stress over time. Mitigating it is a direct circulatory intervention. 1 to 2 teaspoons of apple cider vinegar diluted in a full glass of water, consumed before the 2 largest meals of the day. Always diluted. Undiluted acetic acid damages tooth enamel and esophageal tissue. Always with a straw when possible to minimize tooth contact. The research doses consistently use the diluted form. The preparation that research shows produces the greatest combined acute blood flow. Benefit brings all 3 additions together in what might be called a vascular support water, though the name matters less than the contents. 12 to 16 ounces of water, 1 teaspoon of a balanced electrolyte supplement containing potassium and magnesium, 1 tablespoon of fresh lemon juice or pomegranate concentrate, 1 teaspoon of apple cider vinegar, consumed once in the morning and once in the early afternoon. The morning timing matters because blood viscosity is highest in the early hours after waking, driven by overnight dehydration, the morning hypercoagulable state, and the cortisol surge that increases platelet aggregation tendency. Consuming this combination within 30 minutes of waking targets blood viscosity at its daily peak and produces the most meaningful acute reduction. The afternoon timing matters because blood glucose after lunch represents the second major daily spike in post-meal viscosity. Consuming the apple cider vinegar-containing version before or with the afternoon meal blunts that spike and maintains the blood flow improvements initiated in the morning. Research on combined electrolyte, flavonoid, and acetic acid interventions in adults over 60 is still emerging, but the individual mechanisms are well established. The compounds are safe at the doses described, and the interactions between them are additive rather than conflicting. Each targets a different driver of age-related blood viscosity and endothelial dysfunction. To close, after 60, plain water dilutes blood volume, which is valuable, but leaves three specific vascular mechanisms unaddressed: electrolyte-dependent arterial smooth muscle tone, nitric oxide availability through both the endothelial and dietary nitrate pathways, and the post-meal blood viscosity, spikes that contribute to daily circulatory stress. Addition 1, potassium and magnesium in water, directly supports arterial smooth muscle relaxation and corrects the mineral deficiencies that drive arterial stiffness and elevated peripheral resistance. Addition 2, lemon juice or pomegranate concentrate, activates the dietary nitrate and flavonoid pathways that bypass age-related endothelial decline and restore nitric oxide-mediated vasodilation. Addition 3, diluted apple cider vinegar, reduces platelet aggregation tendency, lowers blood triglycerides, and blunts post-meal glucose spikes that acutely thicken the blood after every large meal. None of this requires abandoning plain water. It requires augmenting it with compounds that the aging vascular system needs and that plain water cannot provide. The habit takes 60 seconds to prepare, the compounds cost almost nothing, and the mechanisms behind them are documented in peer-reviewed cardiovascular research, not in wellness culture speculation. Share this with someone over 60 who drinks water diligently and still deals with poor circulation, cold extremities, or unexplained cardiovascular symptoms, because the gap between what they are drinking and what their vascular system needs may be smaller than they think, and easier to close than anyone has told them. For those ready to build a complete blood flow optimization system around these additions, the description has a full vascular hydration protocol covering optimal daily fluid timing, the complete electrolyte and flavonoid supplement stack shown in research to produce sustained improvements in arterial compliance, and the dietary and lifestyle adjustments that compound the effect of improved hydration in adults over 60 managing long-term cardiovascular health. The link is in the description below or pinned at the top of the comments. Plain water kept things running for 60 years. What comes next requires a little more.